So the purpose of this activity is to learn about the emergency treatment of stroke. The reference group is going to be third week ER nurse interns. And we will be using Socratic questioning. So let's start off by saying, what are the signs and symptoms of a stroke?
Someone having a stroke could have one-sided facial droop, slurred speech, and weakness.
All right, that's a good start. Are there any additional signs or symptoms of a stroke?
Well, there could be confusion, vision changes, dizziness, or a headache.
Also high blood pressure, increased temperature.
All right, that's definitely a good start for some signs and symptoms. So, of these symptoms and signs, what would be causing this in the patient physiologically?
Lack of oxygen to the brain causing neurological symptoms.
Okay.
It can vary depending on the amount of brain tissue that's being affected at the time.
All right. So in an emergency room setting, as the ER nurse, once you've identified that these symptoms are happening in your patient, what are your priorities?
Well, to notify the ER physician and can contact the CT department to alert them of the need for a rapid head CT.
Okay, that makes sense. Why would we need to alert the CT department?
Because we will need an interpreted CT of the head prior to making the treatment decisions based on whether it is ischemic or hemorrhagic.
All right. So what would be the difference in an ischemic versus hemorrhagic stroke?
Ischemic is caused by cut off the blood flow to the brain. Hemorrhage is caused by a broken blood vessel.
All right. And why would knowing the difference between those two, ischemic or hemorrhagic, why would that make a difference?
Well, it's going to determine what type of treatment that you're going to provide for the patient. You could give tissue plasminogen activator, TPA, or you could have a surgical intervention take place.
Okay, so why are we hurrying? Why are we hurrying to call the CT?
Time is tissue. The faster you can restore oxygenation to the brain tissue, the less long-term effects the patient will have.
All right.
Okay, also TPA, you've only got 3 hours from the onset of the symptoms to give it.
Okay, well that definitely seems like a reason to get moving, doesn't it? So, are there any things that we need to do, or is that it? We're just calling the CT and talking to the physician, right?
Well, no, like any other patient that is having a condition, we need to get labs like a CBC, CMP, PT, INR, so we have a better picture of what's going on with the patient.
Okay, why those labs specifically?
Well, it's used to determine if they can even have TPA, as well as any other complications that might be contributing to conditions like confusion, such as electrolyte imbalances.
We would also need to start at 2 large bore IVs in case they need to give TPA as well.
Another priority would be to get an NIH stroke scale assessment on the patient.
Well, definitely those are good deals, but what is an NIH stroke scale now, since you mentioned it?
Well, it is an international standard for determining the extent of a stroke severity.
It ranges from 0 to 42, with 1 to 4 being minor, 5 to 15 being moderate, 16 to 20 moderate to severe, and 21 to 42 severe.
Well, those numbers sound great, but why do those numbers matter?
Well, it determines a baseline to see if the patient is getting better or worse.
It also is one of the components of determining if an ischemic stroke can be treated with TPA.
That definitely makes sense. So, all of you keep saying now you're wanting to do all these things in a hurry, right? That's a lot of things. So, in what order would you prioritize your steps once you determine that this patient is having stroke-like symptoms?
You have to notify the doctor and the CT first.
I agree, but you next need to get a good history and the NIH stroke scale assessment so you can have a beginning baseline.
I would say get them to a CT as soon as they are ready, but you could be doing the history, NIH assessment, and IVs and labs during this simultaneously.
Yeah, I think the CT should be the most important because you have to wait for the interpretation, but you could still be getting a lot of this together while you're waiting.
Well, it seems like you all have a good idea about stroke presentations and how to prioritize for the best patient outcomes. Remember to keep yourself familiar with those signs and symptoms of stroke, as well as how to perform that NIH stroke scale, as those will be key tools in your future as an ER nurse. Thank y'all.
You're welcome.
Right on time, right?